15 minutes after the webinar if there are any additional questions, but we're super excited and thank you for coming to spend this afternoon with us. And so with that being said, Sophia, you are free to spotlight Rachel and Kat so that we can start our conversation. And again, it's going to be Kat Atkinson, our policy analyst on school-based mental health, as well as our CEO, Rachael Deane. So the floor is yours.
Thanks, Jeremy, so much for welcoming us, and thank you all for being here. We're really excited to be able to talk a little bit more about school-based mental health just generally, but then also in the wake of this report that we put together and put out, going over the initiatives that we have so far in the state, but then also thinking forward to how we can continue to build a framework that really aligns equity, ensures that young people are supported, and have what they need in their schools and in their communities. Really excited to be able to speak with our CEO and also just share more about what we've been working on. So just some introductions. My name is Kat Atkinson. I use she/her pronouns. I am Voice's Mental Health Policy Analyst, coming from working at a local Department of Social Services prior to this, and with a social work background. Really excited to be able to bring that healing-centered perspective to policy work and uplift voices of community members and young people in this space.
Hi, everyone. I'm Rachael Deane. I serve as the Chief Executive Officer at Voices and came to Voices after many years as a policy advocate and legal aid attorney, focusing mostly on education and special education law. And I am thrilled to be here today with Kat and to walk through a conversation about our recent report on school-based mental health and start to think about what it's bringing up and what implications school-based mental health programming has for the wellness of our students across the state. So we're going to discuss a little bit, share some information, and then have more of a conversation at the end with questions from the audience. So I think first, Kat, tell us how this report came about and why did Voices decide to dive into the issue of school-based mental health and start a conversation?
Sure. This is kind of like a twofold piece. There's a personal piece to it, which is coming from my background, and then there's also Voices as a whole having kind of spearheaded some of the pilot programming prior to my time at Voices. And so to kind of touch on the personal piece, I worked at a local Department of Social Services. I was in Chesterfield doing prevention work, and most of the needs of my students and the kids that I worked with were mental health. And, we worked with community-based providers, but then we also knew the one place I could see my kids, the one place I could always engage with them was at their schools. And I really saw a need and a want for all of my kiddos across the area that I was in to be able to have access to services in their schools. And it wasn't the same in every single every single school that I was in. So that's one piece, and that's like kind of the personal drive that I have is I wish that I could have seen a lot of my kiddos get the services that they needed. But then from Voices perspective, in November, the Behavioral Health Commission came out with a report called Maximizing School-Based Mental Health Services, and it really dived into that pilot program that I touched on in the report. And it kind of I paired that with the context that I was seeing in my experience, and really the voices of practitioners and students and young people in our Virginia's Youth in Action program, to really bring about, okay, this is something that we need to be talking about. Schools are the one place that young people will always be, and that is where they are going to have their needs met across the board. So it really just was to level the playing field and provide context for what is this thing, and where can we go with it in the state of Virginia.
Yeah, I think all of that, and also just zooming out, as many folks in the audience are aware, certainly as Voices is aware, Virginia has a youth mental health crisis. And it's a crisis of youth wellness, but also a crisis of access to services. We were ranked 48th in the nation at the end of 2022 by Mental Health America in terms of access to youth mental health services. And I know we at Voices, and along with many of our partners, we've been thinking through how can we increase services and how can we make them as accessible as possible for youth and families. And certainly the school setting, as you said, is it's where we hope all young people are at any given time. Exactly. So for folks who maybe haven't read all of the report yet, or who are just coming into this conversation new, what is school-based mental health and why does it matter for Virginia's children?
Yeah, so school-based mental health, we kind of look at it from the perspective of the health and then also the services themselves. So school-based mental health is programming that's designed to meet the holistic well-being needs of students in a public school setting. Obviously, it can also be in private schools, it could be in colleges. We're thinking, there is a broad way that we can look at school-based mental health. But in this report, we really focused it on like K through 12 public schools. And then school-based mental health services are the multi-tiered supports and programs that increase access to the various types of mental health resources across the continuum. And with it has a very particular focus on prevention. And so those tiers, we've got tier 1 services, which are universal. We have those tier 2, which are more selected interventions that can be like group therapies. And then we have the tier 3, which is the more higher level needed interventions for folks and young people with like really significant needs. And Virginia sits in that multi-tiered systems of support framework. So school-based mental health services kind of should be fitting into that same sort of framework. These programs are really important, kind of like what we already said, where we're navigating youth mental health crisis. We are seeing that, again, the one place that we hope our young people are in schools. And it is a way that we can really meet those equity issues, bridge some of that accessibility, really help young people overcome those many different barriers that they may see to receiving access to those mental health services. And it helps us kind of, again, get on the same playing field across the state, where we can say our young people are really important and we need to make sure that they are supported for their future. And so, really, regardless of locality, students should be able to have access to mental health services, period. And this is one way that we can meet them.
Yeah. So, I mean, you said overcoming equity problems and equity challenges. What kind of equity challenges are we seeing at Voices in terms of accessing mental health services?
So some of the general ones are different localities have different resources, and that is something in many conversations I've had with folks across the state who are working in these schools, that some of them don't even have mental health professionals in their schools, period. Or, they may have school counselors who are providing some of those services, but are still being pulled in multiple different directions, doing testing and things like that. But then we might see in some of our more resourced areas where they have a mental health professional in every single one of their schools, or we might see that they have social workers and psychologists in the schools, whereas there's areas that don't even have a nurse practitioner. And some of our young people even shared that in previous years, that their schools don't even have a nurse practitioner. So, really it's disparities across the state, depending on where they are. Different infrastructure is accessible or not accessible. So some schools may have access to telehealth, some may not have that infrastructure to, have the broadband to even have telehealth in their schools. So there's just a lot of differences across the state, and in the same way, we also have the barrier of even young people being able to go out to their community providers. There could be an issue of distance. They might not have transportation, because sometimes young people's only transportation is a bus to school. So there is a broad mix of things that could create a challenge for why we aren't able to meet these needs. And of course, we have the workforce shortage, which is just a whole bigger systemic issue that we have to be addressing at the same time.
Yeah, and I know we're going to get to the workforce shortage and possible solutions for that later in the conversation. I think in terms of equity, there's also racial equity.
Mm-hmm.
We think about a lot at Voices. And I know that in some of the less resourced school divisions in the state, and particularly with the way our funding works in terms of K-12 education, the less resourced areas are often the most segregated areas. And as you said, not only are the wealth isn't there, the monetary resources aren't there, the providers aren't always there. And so we see big racial disparities in access, and income disparities too. I know that we've talked a lot at Voices about the use of Medicaid and whether Medicaid recipients have access to various mental health services. But going back to school-based mental health, so these are programs in school. Who's providing this type of program or support or service? And what are some examples? Like, what does it look like in practice?
So it kind of is, we continue to say a continuum, and also that there's not a one size fits all for every individual, every school. But the standards are there are school counselors that do provide mental health services. We've got our school psychologists, we have school psychologists, and those are folks who can be both hired by the school to provide the services in schools, or can be contracted out to our community-based providers or community-based agencies who come in and can be partnered with the school divisions and come in and provide those services externally, but sitting inside of the school setting. Of course, like if we think about the tiered level of supports, every adult professional in a school is providing some perspective on mental health support for our students and wellness just in general by how they show up for students, the social emotional learning classes that we have, just general programming, even at general assemblies where people go and speak about suicide awareness, or just various different ways that they're showing up. And so we are really looking, in this report, we touch on the pilot and we touch on school-based health centers, but there is so much going on in the schools to support our young people, and it can be better funded, it can be better supported by the state, and even federally.
I've seen it in my children's own schools, and we talk about it as a spectrum or continuum, and it's everything from my daughter's kindergarten class getting a visit from the counselor doing a social emotional lesson for the day or during morning meeting, to individual students being pulled out for more intensive therapeutic services. So you mentioned the pilot, and I want to make sure that we talk about what the pilot is before we get into some of the takeaways from the report.
Sure.
What's the pilot?
So this is was, because we did lose some funding on this for in this General Assembly session, but the school-based mental health pilot or integration pilot was created to provide grant funding to local school divisions to help them develop contracts and partnerships with community-based providers in the schools to do various types of programming. Granted, the funding was flexible, and so some school divisions chose to use the funding to hire professionals for the cycle of funding that they had. They used it to develop some restorative practices. So each school kind of was able to meet their needs with the funding that they had to address some of these mental health challenges that they were seeing in their students. And so that is the gist of it. It was, we had $15 million each fiscal year that were allowed to be allocated out. And at this point in time, I know the school year is coming to an end. We had about 23 school divisions who were utilizing that funding to meet the various needs in their community to provide school-based mental health services to their students.
Okay, so we know obviously there's a big need for access to more mental health services for young people. We know that school can be a positive place to implement some of that programming. And there has been a pilot for school-based mental health partnerships. So what are the major takeaways from this report and some of the conclusions that you reached?
Yeah, so I mean, I think the biggest one is just the needing to be on the same page about funding, and understanding the various types of funding that we have available to school divisions. And like, to be completely honest, like I'm still learning about even our federal dollars. You know, we're a state policy organization, so we generally focus on that, but school divisions and localities being able to pull down that federal money to kind of meet some of the missing needs, even that's a piece that really is important to be focusing on. Of course, the state should be funding our schools, and I think that that's something that we feel really strongly about, being a part of the Fund Our Schools Coalition, who we love, and we've loved working with them.
Good shout out.
Yes.
Hey, Fund Our Schools.
And, you know, so how do we make sure that the schools are getting as many dollars as necessary to meet those needs across the board? You know, there is those disparities that we talked about. I think that's another takeaway. The full language from the Behavioral Health Commission's report that showcased different levels of need comparatively between like the Northern Neck and Nova have huge differences in how they meet their tier 2 and tier 3 services for students. And really seeing that funding and that equity in funding, and knowing that some communities might already have more because localities are able to meet those needs or are choosing to provide that funding, and some localities cannot. So how do we make sure that funding is flexible and is able to meet the various community differences that we have? I think some of the other pieces that school-based mental health is not a one-size-fits-all. Again, each community can decide how they can meet the needs best. So I think a perfect example is we went to Petersburg High School and recently, last week, and we spoke with the folks at the Crimson Clinic, which is a school-based health center that is located within that high school, and they get to do services for students. They do health, dental, they do physicals, they do mental health services. And that is a really great holistic approach to the various needs that they have in the Petersburg area. And that was something that they did on their own, and that the community jumped in on, and they got philanthropic dollars and then partnered with the federally qualified health center. So the communities know what they need. And I think that it is important to really highlight that and uplift that, and that the localities can advocate for those needs and request that funding down if we have it, if it's allocated, of course.
Yeah, I mean, definitely picking up on the it's not one size fits all. That school-based mental health services are often tailored and created with the unique needs of that school, that community, those students in mind. And the funding is not one size fits all, right? The funding should be very flexible, but it's coming from a lot of different streams, right? So Medicaid is part of this. Some of the funding is based on the SOQ. It's funding from Virginia's school funding formula that is allocated to every division each year by the General Assembly. And as you said, some of these services are actually supported by philanthropic dollars, right? So foundations who are in local communities and supporting providers in the area.
Exactly.
And I know that the report goes over a lot of that in some of those examples.
Yeah, definitely. And that definitely sums it up pretty well. And I think that all of this concurrently talks about that addressing the workforce shortage that we have. And that is a through line, I think, in every conversation I've had and every young person I've heard saying we need more staff in our schools. Really addressing that at the core is like really what's going to help us get this framework put together. Because if we don't have the staff and we have ratios for staff in schools, we aren't going to be able to meet those ratios if we just don't have the workforce at all. And really just getting clear about Virginia's why for school-based mental health. Why are we doing it? Is it for academics, or is it to actually help our young people be well and have a future that is well?
Yeah, so we're still going to get to the workforce shortage, but we're trying to get to. I want to talk about what's working before we talk about like challenges and potential opportunities. But I really want to dig into this. What's the why? So when I think about school-based mental health services, I think about both, right? We're supporting like mental and physical wellness. And we're also acknowledging that when you show up and you're physically and mentally well, you're more likely to have more positive academic outcomes. So let's talk a little bit about that, with the why and how you've grappled with that.
Yeah, well, I think a perfect example is I'm not gonna share their name, but there's a provider that I spoke to who shared some examples with me about their school division, and they have young people coming into their schools as young as 4 who have shared with staff that they were spending the night in their bathtub because of shootings in their neighborhood. And they're coming into school and expected to show up and produce. And again, we live in a state of capitalism. That is the way that we kind of exist in the world, is we have to produce and we have to show up and we have to do well. And especially in schools, it makes sense. We say school ensures our future, and like having those academics really will allow us to be successful. But we have to kind of take even a further step back, where the way we are successful is to ensure that people are taken care of, and we're trauma informed and we're healing centered in the way that we talk about our young people and like what they have to go through every day just to get up and come to school. And even young people that I hear all the way up into college, these are similar things that they're experiencing, whether it's economic insecurity and trying to be able to get through even grad school, like things like that, that if you are not at a baseline, at a certain level of wellness where you're not experiencing daily traumas, and those things that we call social determinants of health, where we're experiencing racial discrimination in our everyday lives, like how can you expect folks to do well and represent a school well if that is what the goal is for a school division, is just to focus on our academics and making sure our kids graduate. Well, how do we ensure that they graduate, make sure that they're well? And so that's really, like, hearing those stories are really what make it very clear to me that naturally, if our goals are aligned, if we ensure that our young people are healthy, both physically and mentally.
Yeah. And I'm glad you brought up trauma informed and healing centered, right? Because we're not only, we're talking about mental health services, but we're talking about mental health services and professionals who are trained in being trauma informed, because that's a lot of what we're responding to, or they're responding to, in communities. And I think that point you made about showing up, a child showing up to school, and they're bringing with them their entire experience, right? And I think schools are such anchors of communities, and as the community goes, the school goes, and vice versa. I know just in my own experience and experience of a lot of other parents, when something traumatizing happens in a school division, it has ripples out to the entire division. It's going to affect all of the students and all of the staff. And I think that's just another reason why having school-based services and programming is so important.
Yeah, I mean,
it's really building up the entire community.
Yeah, another example is the practitioner that is at the Crimson Clinic. She shared that she has a huge caseload, but she had to spend a week doing grief counseling for the students in the community because of a shooting that occurred. And that is the work, and that is what we want to be sure that all students across the state have access to, because as we know, that is something that is continuing to be a challenge for our communities, is the violence, the community violence, and those pieces that are really hard to get at the root of, but at least we can have the accessibility to support the symptoms and the trauma that happens from them.
Yeah. Okay, so we talked a little bit about the why, and certainly heard about your why and the voices why. What is working with respect to school-based mental health? Like, what are the success stories? What's giving you hope?
I think that I do think that the work of the pilot has been really exciting to hear about and see. I spoke with some folks from the Department of Behavioral Health who've been measuring some of these school divisions and what they've been able to do with that funding, and even just the community's ability to build partnership with their CSBs, or the community service boards, with their behavioral health authorities, to meet some of those needs in the schools. I think there are fabulous folks already in the schools doing this work all the time and having to put so much on hold to really care for our young people. And I think that that is just that's our baseline, and that's what we need to keep amplifying. And I think that what we have seen is that flexible funding does work, and it does support these needs. And and also you said all those different streams working together. I can see in some localities like Henrico, they've developed their own school-based mental health programming called Henrico Cares that is pulled from various different dollars, and the locality is on board with this, and they've been able to uplift the work of all of the professionals that are in their schools and meet those needs. Really highlighting those two pieces where I think that there is a big commitment to meet the need of mental health right now, and there are way more ways that we can ensure that it is consistent and we can see like a longitudinal effect of programming.
Great. Okay. So challenges. As you were doing research and talking to folks out in the field, what were some of the consistent challenges you came across?
Consistent funding. We can talk about
funding.
Flexible funding all we want, but funding changing or not being completely clear on again that why, like the pilot has just shifted the funding that we had received, that 15 million each year. This General Assembly session shifted to focus on school-based mental health clinics, which, as we know, do amazing work, and they are highly focused on health and wellness. And again, if we're talking about this workforce shortage that we will continue to talk about, how do we know that we're going to be able to get more of those staff in those clinics? And I think that we keep switching back and forth between different ways of doing and being in the school-based mental health world, which makes it hard to fund things consistently if we have different ideas of what it can look like or what it should look like. So that is, I think, a big one. And again, some localities are able to and willing to provide more funding, some are not. And we are continuing to have more conversations around what funding can look like in the future for school-based mental health. And then really staffing, that is the biggest concurrent issue across the board. And it is not just in schools, it is also in our community-based providers, like the network. It is happening across the nation. We have seen this like consistently. And, a perfect example, I myself was a provider. I was working in a direct practice and have shifted into a different role because I couldn't do it personally. It was too difficult for me to be seeing what I was seeing in the field, and I wasn't getting paid enough for the amount of work that I knew I wanted to be able to do for my young people that I was working with.
Yeah. And I think in the school setting, it's particularly challenging because there's also an educator shortage. So there's a school staffing shortage on a number of fronts. We have some data here from the Virginia Healthcare Foundation, who provides really great information about the healthcare workforce across Virginia. According to VHCF, 93 out of 133 localities in Virginia are federally designated mental health professional workforce shortage areas. And 2 million Virginians live in those areas. That's 37% of our overall population. 2 localities have no licensed behavioral health professionals. 35 have no trained behavioral health prescriber. And this is what blew me away. 88 localities across Virginia do not have a child and adolescent psychiatrist, whereas 2 localities, Richmond and Fairfax, have more than 26. Which, the Richmond and Fairfax are more populated. So I want to put that out there for some context. But gosh, 88 localities don't have a child or adolescent psychiatrist. What is this workforce shortage doing to Virginia? And what are some of the suggestions and policy recommendations for trying to solve it?
So I think that for the first piece of that is that we are seeing, a perfect example is we're 48 in access to youth mental health services in the state. That is, a clear line between what we're seeing. And I think that on the ground, what I have heard from young people and from practitioners and things like that is is that we have more need, and young people are sharing that they are not okay and they're not well and they're not able to be well. And I think that, you know, it makes it difficult on everyone, parents, systems. I know the school divisions, like it is a challenge for everyone who is in touch with both the system and the young people. I don't know if you want to share.
No, I almost feel like saying, raise your hand if you've been on a waiting list for services for your child, because they are months long, and it is like a second job trying to navigate. I mean, truly, really just takes a lot of time and effort and commitment to navigate the system for your children, to try to get them the mental health care that they need and deserve.
And I think even working at a Department of Social Service, that was the biggest challenge, because we have timelines for our cases and going to court. And if we have a court date in 6 months and they're expected to have X number of therapy sessions, or begin being prescribed something, or have their substance abuse disorder treated, and the wait list is till the next year, how are we supposed to even address some of those bigger issues that we have? So we could probably go on forever about that. But basically what we are seeing, and this is some of the recommendations that I have seen from the Virginia Health Development Workforce Authority, as well as we did see a few pieces of legislation come through the pipeline this year on how we can kind of address the recruitment piece and the retention piece, because we have people in the field doing amazing work, and I know many of them who want to quit, like friends and family. And so how do we recruit? I think a big piece of that is, are we making sure that we're recruiting different types of people in the work? Do we have folks
tell me about
who
that.
are representative of our young people, who are, you know, able to provide different types of services that are maybe culturally rooted or healing centered, that are not just, you know, purely evidence-based, because there are different needs for different young people. I know for myself, talk therapy hasn't worked for me, but nature therapy and dance therapy have helped me for my own mental health needs. So how do we make sure that we have a diverse group of folks in the workforce? So some of the things that we saw this year were Virginia is going to be able to sign on to the Social Work Licensure Compact. So that allows folks from other states to come here and practice social work if they are licensed. So that is a caveat. We also almost got through a bill around alternatives to licensure. There is lots of literature that you can find, and lots of truth around how licensure is racist and is significantly challenging and expensive, and that is not accessible to many different folks doing this work. And so they have huge barriers to get licensed.
And there's some specific to the exam too, right? Is what I was reading. Yes. It's a huge hurdle for developing a diverse social work workforce. I know too. I'm like, you know, raise your hand if you have student loans. That loan repayment programs have been another potential policy solution, and that's a recruitment tool to help folks offset some of those student loans if they're joining the workforce and providing that service. Tell me a little bit more about kind of how you look at the need for culturally responsive mental health treatment and care, not just in schools, but more broadly.
Some of the perspectives I think are, well, one, it's still new, even though this has been happening in different cultures forever. How do we meet various needs within our communities, and then outwardly, how do we showcase that, you know, we have our backs and we are supporting ourselves? I think that a big piece of it is, how are we thinking about mental health, and if it's purely medical, if it's clinical, or is there nature involved, or is there there's lots of different ways to think about mental health. Is it in our DNA? Is it, you know, we talk about like nature versus nurture, things like that. Our community really impacts, you know, the way we both grow up and the way we heal. So culturally responsive and culturally rooted practices really get at okay, what do I need as someone existing in the world as maybe other or different, or, being a Black woman in society, all the research that has been done on white men is not necessarily going to be supportive of my needs as someone who has a vastly different experience in society. So that's just like kind of to touch on some of that. And, this is a piece that I think as an organization and as an individual, I just want to learn more about, and how we can bring those services into a more understood limelight.
Mm-hmm. And I know that stigma is culturally relevant, right? Stigma is going to look different according to what community or culture you're in or you're working in. What other policy solutions have we discussed? I want to bring us back to a solution-oriented lens, and of course, always the lens of legislation and public policy. So tell me a little bit more about what other potential opportunities lawmakers should be considering.
Yeah. So we kind of broke in the report down a couple different ways that we can look at legislation, but also look at humans in legislation and policy. So we definitely touched on some of that interpersonal inner work that is tenets of healing-centered engagement. And you can definitely see in the report some resources that direct you to Dr. Sean Jenright and how are we as individuals in policy viewing mental health, and how are we as folks who are engaging policymakers about humans, and how are we showing up in that way. So there's some conversation around that interpersonal. We also have to look at how do we create access for localities to know what they have access to. I had a meeting with some folks who didn't even know that there was a loan repayment program for behavioral health professionals. Why is that so? Is it not widely known? We have to ask some of those questions about how are our legislators able to bring back information to their communities about what is available to them,
and technical assistance, right? Like helping folks at the community level navigate some of these the paperwork, the drawing down of funds, that sort of thing.
Yeah, and I mean, I think that's a big one, is how do we make sure we again are working on the staffing to ensure that all localities have access to someone who can bill for Medicaid, or know how to bill for Medicaid, or have folks who have the expertise to write grants. And many of our mental health professionals in schools do have that knowledge and ability, but don't have the time or the capacity to be able to do that. We're looking at, again, state funding. There is language to develop a new plan to do flexible funding to localities for school-based mental health programming. So what will that look like? We're going to have to kind of wait and see. And then just systematically, how do we all get on board to focus on what is needed, which is young people need to be well. So we have to kind of pull on all of these strings to kind of get to a place where we're all on that same page. And I think that that plan that could be coming out in the next year around what funding could look like is a great way to make sure that we're starting to build the framework for a school-based mental health system that prioritizes young people, that centers accessibility and equity, and really highlights the need for.
Well said. All working together for the wellness of young people. Yeah. I think that's a great point to pause and take some questions from the audience today. So we will, I think the instruction is to drop questions into the chat. All right. So yeah, please do use the chat function on the Zoom panel to drop your questions, and we'll have a little bit of question and answer before we close out today.
Yeah, so if you all can drop your questions in the chat. I know some folks are probably used to saying them audibly, but just for accessibility
Okay,
reasons.
so our first question is, how can others join hands on the work of expanding school-based mental health services? What are some advocacy opportunities?
Yes,
we love to talk about that.
Love that. Yeah. Well, various ways. You can talk to us individually. You can meet with our advocacy and engagement team. I do think just naturally a big piece of this is sharing your truths and sharing your stories. And I'm lucky to be able to meet with so many awesome folks who are in the field and hear from them and uplift those things that have been shared with me as best as I can in the work that I'm doing. But we need as many voices as possible, like sharing stories, sharing your own personal experiences as parents, as caregivers, as siblings, as practitioners, as folks in the state agencies. We need to hear what's going on. And I think that that's truly the most important piece is truth telling for sure. And I don't know if there's anything else you would add. But.
Well, I'm just wondering, what are the next? So we've finished a General Assembly session. We're approaching the summer, and we recently have a state compromise budget that was passed by the General Assembly. So what are the next big steps in terms of enhancing school-based mental health in Virginia?
So some of the things that we have kind of began to talk about is how do we prioritize mental health in those school-based health centers? You know, considering that that is where funding is right now. Okay, we want to make sure that we're leveraging as much of that mental health language as possible in those spaces. You know, mental health is health, and it has different needs different requirements to meet needs. I think that is kind of the big piece right now for us as an organization, and then another piece is the Medicaid part. And myself and our economic security and health equity senior policy analyst Emily Moore have a lot of conversations going on right now about how we can get that technical assistance to schools, make sure that folks know that they have access to Medicaid services. And she's more suited to talk about the parity between making sure that behavioral health is reimbursed at the same level as physical health.
We may need to host another conversation just about the ins and outs of Medicaid and technical assistance. I do have one update from one of our friends who is one of the staffers at the Virginia Healthcare Foundation. Thanks, Denise. Denise is pointing out that so updated data, actually, as of November 2023, all Virginia localities are now mental health professional shortage areas. So big update there. Really you can see the statewide nature of the shortage. I want to go to another question is whether there's been much discussion at the state level about the community schools model, and I can address that. Yes, there has been. I think there has been great interest among community members, advocates, and lawmakers in the community schools model. And I know there are some VDOE folks, I think, on this on the Zoom. So I don't want to misname the team, but I know VDOE has like an office or some staff who are dedicated to exploring that and to providing assistance to divisions who are interested in the community schools model. And just as an advocate, I think it's something worth exploring, and it's something that can be uniquely tailored to the needs of the students and families in that area. We have another question is, it says, can you all talk more about the Petersburg Health Clinic? Were they doing one-on-one counseling appointments? And so we took a field trip as Voices staff last week down to Petersburg High School, visited the Crimson Clinic. It's an example of another approach to school-based mental health. So the Crimson Clinic is a federally qualified health center, FQHC, and it is a full-service community health clinic that is located inside a high school.
Yep.
And is operated by one of the community-based health providers in that area. It is staffed with, I think, a pediatrician, a nurse practitioner, and a licensed clinical social worker. And folks in that clinic do see students. They see students who walk in from the hallways of the school, and they also see community members. So it's a great model for co-locating those services. What were some of your takeaways from that?
I think the coolest part to me was that they had opportunities for confidential appointments for students, I think starting at age 14, and they also serve all of that community. It is not just students in the school, it is also parents, it is students in other schools. And they get primary care there. And one of the pediatrician there is also works in the community as a provider. So they get their primary care in the clinic, but also they can see them outside the clinic. The counselor, or the licensed clinical social worker there actually does one-on-one counseling. She does group therapy. She was talking a lot about how she does a lot of play therapy. She also has developed some programming to support staff, which is fabulous. They are doing yoga classes after school ends for the staff to kind of, reflect and take a second away from, the students and the work that they have to do. They're providing programming around various different needs. And I think that I really appreciate that they don't turn anyone away, no matter what your situation is, and they have lots of opportunities for students to be able to get services, whether or not they have insurance or whether or not they have even knowledge of those things from their parents. So, and they also have community health workers that work there as well.
We love community health workers.
Yes, and they go out they help family members get access to Medicaid if they maybe don't have access to that. Just really fabulous what they're able to do in that very small space. And they even shared that was like one of the bigger spaces that other clinics don't have. So
yeah, I thought it was a great example of how services can be co-located. More specific information in the chat, which is very helpful. It's the Office of Behavioral Health and Wellness at VDOE, which is leading the work on increasing implementation of a community schools framework in divisions across the state. And there's a contact here in case folks are interested in more specific information about the community schools framework. All right, I think that's the end of our questions for the day. Kat, what's the best way to reach out in case folks have other questions or just want to chat?
Yep, you can email me at kat@vakids.org. And I love meeting with folks and talking about all of this because I learned so much from just having conversation. I really want to dream on how we can work together as advocates and as folks in the community to just amplify this work just generally. That is the best way. Just send me an email and we'll find a time.
Great. Stay tuned to Voices. We send out emails and newsletters. We are planning additional webinar conversations about school-based mental health, including a conversation with school-based mental health providers who will be joining Kat. And we also have a feedback link for this webinar, and I think that is going to be going into the chat as well. We have, I think that's it. Yeah, join us. Please do stay in touch and be on the lookout for our future webinars to really dive deeper into the topic.
Yeah, I think a little sneak peek is, yes, we're going to have a conversation around with some of the folks who've been at pilot schools and kind of seeing some of the work that they've been doing. We're also hoping to have a panel of young people sharing about their experiences with school-based mental health services and mental health services in general. And then one of our senior policy analysts is hoping to have a conversation around the intersection of economic security and mental health, which will be really exciting. And if there's anything else you want to see from us, definitely put it in that feedback forum. I think that will be a great spot. Please share anything that you might have, any thoughts, anything that we can touch on in the future, and definitely email me and we can schedule a time to chat. I would really love that.
Thanks all for joining. Thanks for the work that you do out in communities, and we will see you soon.
Yes, thanks so much for joining, everyone. So we will send out a recording of this presentation in case you missed something or want to reference it. And again, please complete the survey that we're going to share out shortly. We need your feedback, we need your questions, and we'd love to follow up with you and to stay connected with you throughout this webinar series. Thanks so much. Have a great day.